right. Welcome back, everyone. I'm Richelle, the Real Life Carnivore. Super excited to be returning to you today. I know it's been a while since I've done a live with you guys, but it's been a minute. I've been a little preoccupied. Being pregnant and breastfeeding, and also a little guy that is so close to walking solo has been really taking all of my time and attention. Not that I don't love you guys, but he's my priority. We have a wonderful returning guest today. We have a retired MD, Phil Smith. He is a member of the Steak and Butter Gang community, and I'm so grateful to have met him. He has just been such a light in my life, and I'm really excited to have a conversation with him today. So please join me in welcoming Mr. Phil Smith. Welcome back. Nice to have you. How are you this morning?
Doing great. Doing great.
Great.
Always
Well,
good to be retired.
yeah, to be retired. I wanted to open the conversation this morning with what people can kind of expect, or what you've heard some experiences be for people who have gone carnivore. I think there's a lot of confusion, and a lot of people are looking for a reason to try it, but they're shy to try it, or they're hesitant, or they're afraid. And I would love if you would share your story, so people can get to know who you are, and also what your thoughts are on that.
Okay. Well, I'm 67 years old. I'll be 68 next month. And I discovered I had metabolic syndrome, and I wanted to do something about it. I knew diet was the best thing to do. And I was very familiar with ketogenic diets. So in July of 2023, I went to keto. And I started watching a bunch of YouTube videos just to get some ideas. And I came across this crazy carnivore video with Carrie Mann at Homestead How interviewing Shaun White. I was very intrigued by it. And he talked about Dante Faringo, and he talked about Ken Berry, who's also a family physician like me. And so I went down the rabbit hole for the next 2 weeks and just dug into everything I could, and came out on the other side after watching probably 100 hours of videos thinking, well, this actually makes pretty good physiologic sense and seems to be a lot easier to follow than keto. So I just went all in. And of course, carnivore is a ketogenic diet. It's just a very strict ketogenic diet. So I started on August 3rd of 2023, which now we're in February, so that's about 18 months, about 18 months in. And I like to say that carnivore is simple, but it's not easy. It's simple in that the rules are to eat animal-based products exclusively. That's the simple part. Why it's not always so easy is because of the extreme biological variability we all have. And so for me, I had no problems being very, very strict and transitioning after 2 weeks of keto to carnivore, just dove straight in, had very little issues adapting. And within 4 months, all of my metabolic markers had normalized. So I was pretty pleased with that. And so um, that's when I found Steak and Butter Gal in my 4th month of carnivore, and joined the gang specifically to learn how to do priming and to have kind of a regimen. I found that very helpful for me. I did not think that I needed community. I thought I could get community just from watching YouTube videos, but I've realized over time that interacting with people on a regular basis kept me, I'll say, frosty on top of things, and kept me accountable because it's not just about me. And I really enjoy being in the Steak and Butter Gang, and I participate in the calls and try to provide some comic, if not physiologic and medical background to things when people have questions. But I'm a big fan of helping people learn how to communicate to their doctors more effectively and be able to make informed decisions about their health. So, and explain physiology in a way that people can understand it because it's a passion of mine.
I love that. And I know you've explained it in previous interview with me, but could you do a brief explanation on what metabolic syndrome is for those who don't know? And then I have some follow-up questions for you.
Yeah, so metabolic syndrome is a disorder characterized by 5 markers. Obesity is defined as a BMI of 30 or greater, a waist circumference greater than 42 inches in a male, 40 inches in a female, which indicates, truncal obesity, high triglycerides, uh, low HDL cholesterol, and then high blood sugar. And many people with metabolic syndrome also have hypertension as well, but those are the 5 metabolic markers.
I think that's really helpful for people to understand because then it can kind of give them an idea of what they might be looking for with themselves. Something that really stood out to me about what you shared is that this way of eating carnivore is very simple, yet it's not easy. And for some people, they really struggle when they come to carnivore and they find that keto is kind of the bridge for them. Do you think that people can still experience benefit on keto? Or do you think it's more beneficial to go straight to carnivore? What are your thoughts?
I think people do indeed benefit from ketogenic diets. And I think the good thing about ketogenic diets are they are well researched. There's a lot of scientific evidence around them. Carnivore being a newer version of it doesn't have as much evidence, although we see anecdotal evidence of great improvement of people going from keto to more stricter carnivore as far as low carb goes and getting some benefits that they didn't get when they were on keto low. But when we look at treating specific diseases, like using diet as an adjuvant to your cancer therapy, for instance, there's a lot of published literature about the benefit of ketogenic diets and being in ketosis as and actually measuring the ketones. So we would use ketogenic diets where it's really indicated um, as best based until the evidence shows otherwise. So we're just hoping over time we do get some research going, but right now there's been a lot more money put into keto um, research. So as a
Mhm.
doctor, I'm going to stay as scientific as I can, but I can't deny the incredible numbers, hundreds and hundreds of people who have reversed some really serious conditions,
Mhm.
like inflammatory bowel disease, which are ulcerative colitis and Crohn's, putting those into remission on carnivore, infertility, which you yourself experienced, all kinds of inflammatory and metabolic diseases,
Mhm.
reversing type 2 diabetes, reversing metabolic syndrome, reducing autoimmune disease or putting them in remission, and a large number of joint, muscle, and skin conditions,
Mhm.
not to mention mental health improvements around depression and anxiety
Mhm.
that we see when people go carnivore. So hopefully the science will catch up over time, but that shouldn't hold people back.
I agree. Do you think, as a former physician, do you think that you had a little bit of, or did you experience, and I hate using this term, but cognitive dissonance when you started hearing about carnivore? Were you hesitant about it when you first heard about it
Yeah,
still?
yeah, it's a great question. It's for me, as someone that has an MD and a master's in physiology, If I have long known about ketogenic diets, and years ago, when I was in private practice, my corporation was called Health Lifestyles.
Oh,
And it was because I really focused on not only preventive health as a family physician, but also nutrition and fitness. I had a full-time dietitian that worked with me. Um, I had a arrangement with a local gym where I would do a program with them for weight loss, and I was very keto friendly back then and never heard of carnivore. And so when I started thinking about ketogenic diets, you think about what is going to be beneficial to the individual. So if we think about most Americans eat about 200 to 300 grams of carbs a day, and a typical ketogenic diet is under 100 grams, but some people need to go under 50 grams of carbs a day, and some people don't get benefits till they get to 20 carbs a day. So it only makes sense to me that there might be further benefit if you got below 20 carbs a day. And the reason I say that as a physiologist, we know we have essential fats that we need in our diet. We have essential vitamins, minerals, essential amino acids, but we don't have any essential carbohydrates because the body can manufacture any carbohydrate we might need. And ironically, uh, I was a coach of a co-ed touch football, flag football, and um, softball team when I was in medical school in the undergraduate intramural program. And I don't think I've told you this, Richelle, but the name of it was the ketone bodies. So I think that's so funny because
I've never heard of it before. This is new.
yeah, so I've been pro ketone bodies since medical school. So, and that was my first week of med school that I picked ketone bodies as the name of our
Oh,
intramural team. So,
that's so cool.
but I have to admit, we drank an awful lot of beer. So we were not carnivores.
No, definitely not. Maybe someone someday will come up with some sort of carnivore beer. I often think about the people who consider honey carnivore. You could do the Viking drink mead, but
Yeah.
I still don't think that that's
We
helping.
actually have a mead place right across the street from my home.
Oh, do you?
Yeah. I
No.
don't even know what mead is, but
Oh, yeah. It's a form of fermented honey.
oh, okay.
Yeah, I can't remember where it was, but there was a place in Canada that you used to be able to order mead, and it was delightful. It was very light, very refreshing, not sweet at all. Well, I would say slightly sweet. Now I would probably find it absolutely repulsive, but yeah, it was definitely interesting. Much lighter than say like a beer or a cider or something like that.
Yeah. So anyway, don't know much about it. I'll have to research it.
Yeah,
If
it's interesting.
if it's a Viking drink, it sounds very carnivore-ish.
Yeah,
I need
definitely.
to get one of those big knives that they're always advertising on
Oh
the,
yeah. Put it in your wooden table and have
yeah,
your jug of
it's like
mead.
a Viking knife, yeah. So hi, everybody on live. We see, Lewis and Cobra in Wisconsin. I see Charmaine on and
Todd's here
looks
too.
like Todd's on.
Yeah.
So hi, everyone.
Yeah.
Glad you could make it.
Welcome in. We're grateful you're here. Okay, I wanted to circle back to something else that you mentioned about the doctors because this was something that really spoke to me and it really encouraged me around talking to clients about how to have their doctor be their friend. And I think that
Yeah,
this is something that you articulate so beautifully because I think you and I don't want to butcher your wording, but you've expressed that oftentimes a doctor patient relationship looks like a parent child relationship rather than a friend or a colleague relationship. Can you elaborate on that and what that kind of should look
sure.
like?
Sure. Well, you obviously know what a parent-child relationship is. And often, we doctors, we get pretty busy and we're used to just kind of dispensing advice and figuring people are going to take it or leave it. And so sometimes we approach doctors like we're children and we do whatever the parent tells us to do. And we just kind of go in doe-eyed and not thinking to question anything. But I always enjoyed patients who I could establish an adult relationship with, where we could have conversation. I could explain risk and benefits. And in
Mhm.
fact, I was one of the first doctors, at least in Tampa Bay, but maybe in the whole state of Florida, that had an electronic medical record that I purchased in 1992. And I would print all my prescriptions, and my prescriptions would be printed on a half sheet of paper with a perforation with the prescription on the left. And on the right were all the potential side effects of that medication. And I would discuss those side effects and circle ones that I wanted them to specifically look for. And so not only did I know they were going to get the right medicine because it was printed and not scribbled in my handwriting, but when they got to the pharmacy, I knew that they already were well informed of what side effects and things that they might be prone to. Where before I did that, I didn't realize how many times when pharmacists would counsel people, they would share side effects. And I think the one that really got me was antivert meclizine, which is a drug that we give for vertigo, which is feeling like the room spinning. And the first side effect listed for vertigo, for meclizine, which we use to treat vertigo, the number one side effect is dizziness. And people would go to the pharmacy with vertigo with a meclizine or antivert prescription, and the pharmacist said, well, you could get dizzy on this. It's like, well, the doctor must have made a mistake because that's what I was complaining about. And it's like, when I saw it on the list, I could go, Richelle, I'm going to give you this drug. And when you go to the pharmacist, please note that the number one side effect of this drug is dizziness, because almost everyone taking it is complaining of dizziness. So when they survey people of symptoms, they're going to say dizziness because that's why they're taking it. But you know why you're taking it. And she said, yeah, because I'm dizzy. Yeah, you got it. Okay, so don't worry about that this is going to make you get more dizziness. This is actually for your dizziness. But they put that on there because when they survey people that take it, 90% of the people say they're dizzy, which is ludicrous, but that's just the way things are done.
Is that how they do
And
it for all medications?
so
Symptoms?
not only did the patients appreciate it, the pharmacists started appreciating it.
Hmm.
And they would call me up and send me notes that, oh, we love your electronic prescriptions. And we love the fact that the patient's coming with a list of side effects. So we can reinforce that. And we always know exactly what you're prescribing.
Hmm.
And around the same time, there was unfortunately a child that was hurt by giving 10 times the dosage of something by mistake because the pharmacist didn't see the decimal point. And so everyone in the community was kind of on the alert anyway. So it felt good. Yeah. I got to tell this funny story. I would get, when my patients, so in Florida, we have something called snowbirds. And those are people that come down in the winter and they winter in Florida, then they go back to Michigan or Canada or Maine or wherever they're from. And I would always print out because my records were all computerized. So I would do a printout and I had a summary sheet of what their meds were, what I did to them, what visits we had, what their family history was. I'd put that in a package and hand it to them because every year when you get 80-year-olds driving from Florida to Michigan every winter, um, you'd be surprised. At least one of them gets sick on the en route, driving 1,000 miles back home. And they'd have their medical records with them. And they didn't have to wait until they got up there and someone had to give them the records. And so the doctors would be hand delivered my records. They would be typed, they would be summarized, they would be clean. And I began getting patients from Michigan and Ohio. And I said, well, how'd you find out about us? Oh, my doctor in Michigan says you're the best doctor in Florida. Well, I knew right then that their doctor in Michigan probably had one of my snowbird patients and said, boy, I like this guy. He sends me what I need. He makes my job easier. I'm going to send anyone that goes to Newport Richey, Florida, I'm going to send them to him because I know he's well taken care of. So it was just kind of a funny story. But I think the analogy is for carnivore is why would you not want to be informed? Why would you not want to know the ins and outs of things? Why would you not want to know how to take this simple carnivore diet and make it easier for yourself by troubleshooting any challenges you have and begin to learn what you need to do to tweak it to make it easier? And that's so much easier to do in community because we have literally like 14,000 people in SPG. And you got a lot of people that we're just a volunteer army, so to speak, helping one another out. And it's just a really nice environment for that.
Yeah, I agree with you. And I think community is everything. Much like you, I started my carnivore journey alone, but it was with my husband. And I just knew for me personally, I'm a social butterfly. I need community. I need to be able to plug into something. And I also wanted a deeper accountability just with everything that I was dealing with, recovering from sugar addiction, carb addiction, food addiction, all of the things, just the hormonal shifting that was happening in my body going from one extreme to another. I was willing to do it. And I agree with you. It was simple, but it certainly was not easy. And I definitely had ups and downs and mood swings and struggles and lots of crying episodes my first couple of weeks. Trying to figure out what way of carnivore to do because there's so many different versions of carnivore. Some people describe carnivore as being 70% or more of your diet coming from animal or animal-based products. Some people describe carnivore as only being animal-based products. Some people describe carnivore as only lion diet. And I think that there are a lot of ways to do it and to do it in a way that feels nourishing to you. But I also think the language is very confusing for a lot of people. Did you find it confusing when you first started looking into it? Did you see like animal-based, ketovore, carnivore, lion, all of that stuff and go, what the heck is with all the language?
Well, for me, I had a pretty big why. I knew I had metabolic syndrome, which is basically prediabetes, and I wanted to reverse it. So for me, it was, I'm just going to do this as strictly as possible, and I'm not going to look back, and I'm going to solve my issue. And so for 4 months, I did exactly that. After 3 months, I did priming in SPG, and I loved that. That was a big win for me. But I did not have any issues with not being 100% carnivore the first 6 or 8 months. Now, after that, I would say I will, once in a blue moon, do something that's not strict carnivore. Um, Never do it for a reward. Um, just mainly do it to see how I respond to it. And I find that, for instance, if I get too much cream cheese, I don't feel well. And so cream cheese based things like I make a cheese ball with bacon, cream cheese, and cheddar cheese. I can have that once in a while. It is carnivore, but it's on my edge of what's good for me. And I made an oopsie cake once, and oopsie, that was really bad. I really got sick from that. So felt achy all over.
Mm-hmm.
So I realize I do have my limits,
Mm-hmm.
even though I stay animal based. There are some things that just are not ideal for me. And I
Mm-hmm.
think that's where we have to experiment and be willing to try things, try flavorings. I look at condiments as being an area that um, I don't really get too strict on condiments. I think condiments are good for to keep people carnivore. And there's times that I'll use a little Tabasco sauce in my scrambled eggs in the morning,
You
just because
rebel.
yeah, I just want a little fire in it.
Mm-hmm.
But
Have you?
you know, it'll be like an eighth of a teaspoon. I'm just dashing it on. So
Yeah.
I'm not really worried about that. And I'm very strict about rubs and things. If it has sugar in it, I won't buy it.
Mm-hmm. I think it's important we have to be vigilant about these things too, because there's a lot of sneaky ingredients. I've noticed uh, moving from the US or from Canada to the US has been very eye-opening. There's sugar or dextrose or MSG or high fructose corn syrup in almost everything. Like things that shouldn't be in. I'm like, why does this have to be sweetened? Why does this need sugar? Like, you don't need to have sugar in a steak rub. Like that seems bizarre to me. Uh,
Yeah, like table salt. Why does table salt have sugar in it?
yeah, that
That
seems very.
makes no sense. I mean, sugar is a cheap preservative, right? You
Mm-hmm,
never have to throw sugar out because sugar is antibacterial.
mm-hmm.
So I understand why they put it in, but it's just really hard to find things sometimes.
Yeah, and I hadn't heard that they put sugar in table salt, but I don't use table salt typically. I'm a salt snob. I use my Maldon salt, and I use like a pink Himalayan salt, and then I have a French salt that I really like to use. But
Yeah, but sometimes you're traveling or you're at someone's
correct,
house and
correct.
you know,
Usually have
I
a purse size salt shaker in my diaper bag, actually.
yeah, well, you're smarter than me, Rochelle. Have salt will travel. I carried Himalayan salt for a while, and I got it confiscated at one of the airports by TSA.
Really, they confiscated it? Was it
Yeah,
a really large one, or was it a little teeny tiny one?
it was in so it was in a seasoning container that had originally had something else in it, and I buy the Himalayan salt
Hmm.
and the Redmond salt in the bags, and I pour it into shaker containers to
Hmm.
make it easy. But anyway, it came up on X-ray, and they didn't like it, and they confiscated it.
Oh, that's a bummer. they, they're very sticky about those things, powders and liquids and gels and aerosols and all that kind of stuff.
Yeah. Well,
They have to be nowadays. You never know.
I don't know any pink powders that are being smuggled into the country, but
Paint powders? I haven't heard of that one yet. But
well, Himalayan salt's pink, so the
oh,
fact that
pink powders. I thought you said paint powders. I was like
oh,
paint
pink powder.
powder. Well, you never know. Maybe people are starting to tint, drugs and stuff now to try and get it past certain things. I don't know.
Who knows? Who knows?
Who knows?
So anyway, so back to the question about the doctor though. So I want people to be able to have conversations with their doctor. I want them to be able to ask questions and truly get informed consent, which means you know what the risk and the benefits are for you individually, not for the population. And so, when you're talking about using statins to treat primary prevention for people with high LDL, and I had this conversation with a doctor just recently, which is he was a cardiologist fellow in training. And I said, so what's the number needed to treat a 70-year-old with high LDL cholesterol, no metabolic syndrome, no diabetes, doesn't smoke, to prevent? How many people would you have to treat to get um, to prevent one heart attack? And he said, I actually don't know the answer to that question. And I said, well, it's between 100 and 200 people. So you're going to have, let's say, 150 people take it to prevent one heart attack. So why are you asking people to take it? And I was surprised. Here's someone who's been through an internal medicine residency, a cardiology residency, and now is in a cardiology interventional fellowship. And he did not know the data on using statins for primary prevention, um, for strictly treating LDL cholesterol by itself. So you don't know what your doctor knows and what they don't know, but you get them thinking about things.
Mm-hmm.
And I think you've probably heard me on prior tests that I have something called paroxysmal atrial fibrillation. Atrial fibrillation is when the top chamber of your heart, where the pacemaker of your heart is, quits working, and it kind of quivers and it sends kind of an erratic heartbeat, irregular pulse, and you're prone to get blood clots in that left atrium. And those can break loose and cause stroke. Well, so they put people on anticoagulation with atrial fibrillation. So what do you do with the person who only has it for a short spell on multiple occasions? And there was a research study, it was called a review article, where they looked at all the studies of people with what we call paroxysmal atrial fib, which is they don't have atrial fib all the time. It's not chronic, but they just have it intermittently. And they found in people with pacemakers, if they never had it longer than 5 hours, their risk of the blood thinner was much greater than the risk of a stroke.
Wow.
And the risk of the blood thinner was, for me, 7% a year. And where someone that has chronic atrial fibrillation, the risk of a stroke is about 10% a year.
Mm-hmm.
So it's pretty high.
Mm-hmm.
But when you have paroxysmal atrial fib, less than 5 hours, and my longest bout has been 2.5 hours, I only have a 1% risk of getting a blood clot and having a stroke.
I mean, that's a better ratio. 1% is better than 10%.
Yeah, but treating it with an anticoagulant gives me a 7% risk per year.
Mm-hmm.
So that means treating with an anticoagulant that I don't need. I have a 1% chance of getting a stroke, but if I took an anticoagulant, I'd have a 7% chance, which is 7 times higher risk of having a bleeding stroke, mm-hmm. or a major bleed requiring surgery or transfusion, mm-hmm. every year. And he wasn't aware of that either, this young doctor in training. And I said, I said, just because you don't know doesn't mean that me, the patient, I shouldn't look this up and find out
Mm-hmm.
and do research. And most of this research is available on the National Library of Medicine at their website pubmed.gov, PUBMED. I'll put that in the chat.
I just did. I gotcha.
.gov, and that's the National Library of Medicine for the United States. And it's got everything that you would ever want. It's got very good search engine.
Mm-hmm.
So you can search paroxysmal atrial fib and, stroke or anticoagulation. And you can come up with this Italian article that reviewed the literature. Now, you can't read the whole article, so I had to pay $42 to get the article. But for me, it was worth buying it because it allowed me to not increase my risk by 700% by doing an intervention that I don't need.
I'm curious because I've noticed, in talking about having a friendly relationship with your doctor or like a colleague style relationship with your doctor versus that parent child relationship. There are instances, and I've experienced this myself, and perhaps it's the way I approach things or whatever, because I know that most physicians are busy. They don't always, and I say this because of my experience in Canada. Less than 5 minutes is what you get with a doctor to try and explain what's going on, for them to assess you, and then to either prescribe or indicate what your next steps are. I find that oftentimes the medical practitioner or the nurse practitioner or the doctor or whatever almost gets irritated when I'm trying to ask deeper questions like, okay, well, why would I want to test for that? Or why wouldn't I want to test for this? Or, in the case of when we first moved here to Texas, and I paid a handsome fee to see this doctor because he's the best in the area, and I love him to death. I think still think he's wonderful, but he seemed very irritated that I was asking for such specific tests. Why do you think that would bother a doctor? Do you think it's like the hierarchy thing, or I have a PhD or an MD or whatever? Behind my name that gives me authority, or what do you think that is? Why do some doctors assume that their patients know nothing?
Well, I can't make any judgments about the Canadian health system. In the American health system, if you have a doctor you can't work with, you just move on to someone else. And I've had to fire doctors who I go to see and they don't know how to do a physical exam. But that may be a skill that I have that you may not have.
Mm-hmm.
To know when the doctor doesn't know what they're doing.
Mm-hmm.
So, and shout out to Alyssa. She just joined us.
Yeah. Hey, Alyssa. Hey, Mandy.
So, but it's really getting to know the doctor, and it starts by getting to learn something about them. And I've always found, as when I was in practice, that I would always want to know something about that patient that would help me to connect with them.
Mm-hmm.
And in my electronic chart, I actually had a little area where it was to be used for like alerts and things like that. But I actually would put a little tidbit about the patient that I wanted to keep top of mind.
Mm-hmm.
So for you, it might be, Canadian former bodybuilder, infertility, and just put those keywords in. So it reminds me that when I meet you, I can express something of interest that I know is a hot topic for you and something that you're always wanting to talk about, and it makes a connection. And then at the bottom of my note, I would also put something pertinent that I wanted to ask them about next time. And by doing that, it gave me better connection with my patients. So when you're better connected as a doctor, the patients better connect with you. And I think that phenomenon works both ways because often I go to a new doctor and they don't know I'm a doctor. And I have found the first thing I want to do is get to know something about that individual across from me that I can file away so I can show interest in their life and not just about me all the time. And I don't know, I get annoyed when people say, oh, that's manipulative. And it's like, no, that's not manipulative. That's creating relationship with someone. And creating relationship has to start somewhere. And I'm sincerely interested in knowing something about my doctor so that they're human to me and not just some technician there to work on me.
Yeah, I'm with you, and I found personally, uh, like I said, this is just based off of a lot of experiences that I've had in Canada, and I did have good doctors. It depended on where I lived in Canada, but when I moved to the Greater Toronto area, the level of care just plummeted. Like it was all about how quick can I get you in and out of here, and like looking at the watch and like it was just very, like you said, impersonal. Nobody wanted to take the time to actually get to know me. And I've heard you say, and I've heard other physicians and practitioners say this: if you listen closely, the patient will tell you what is going on with them. They will tell you what's wrong. And
Yeah, and we learned that in medical school to take a good history
Mhm,
and physical.
yeah,
And we used to say 80% of what the patient has, the patient will tell you if you ask the right questions.
correct.
Another 15% is physical findings.
Right.
Another 4% is laboratory.
Hmm.
And less than 1% is based on special studies like
Wow.
CAT scans and MRIs. So the most important thing we do as a doctor is take a good history.
Yeah.
Now, I'm seeing some questions over here.
Mhm. I was just going to
Uh,
ask if you had time to answer.
yeah, so family life said perhaps their big egos. I went to school for a Brazilian years, and now you come in here with Dr. Google telling me what to do. So yeah, and I don't approach it. I was reading on the internet. That's definitely a fingernail on the chalkboard experience when someone comes in with that.
Triggering would be the right word.
Um, so I like to do things. Well, can you share with me this new medicine you're giving me? What's been your experience
Mhm.
on side effects that people have, and how long should I be concerned if I have side effects? Uh, when should I reach out to you, and for which ones? So you can ask very open-ended questions, and you don't come across challenging anyone's ego.
Mhm.
So that's a good way to do it.
And
And Simpson Johns writes,
put it up here.
I listened to another carnivore doctor, and he said that insulin's job isn't to be the key to letting carbs, and that the cells don't even burn carbs. He said it's our job to make fat. Any thoughts? Well, the doctor you're listening to, um, I don't know where he's getting his information. So insulin has over 20 functions in the body. And one of the functions is there are insulin receptors on our myocytes, which are our muscle cells. And those myocytes need insulin in order for glucose to be picked up and transported into the cell, where in the cytoplasm of the cell, glucose is broken down in uh, through what we call glycolysis into pyruvate. And then the pyruvate is absorbed into our mitochondria, where the Krebs cycle takes the pyruvic acid and breaks it down and generates ADP, which is the energy unit for the myocyte, from AMP. So it takes ATP, which is adenosine triphosphate, and creates those from ADP. And without insulin, your myocytes literally starve because they can't get adequate glucose into the cells to make the energy that they need. Now, if you have excess carbohydrates in the bloodstream and the myocytes can't let them in, or if your insulin's not working, another function of insulin is anabolic function, which is converting excess carbohydrates into a storage form known as fatty acids. And those fatty acids are stored in our fat cells. So the doctor's telling you one function of insulin, but ignoring another function of insulin. And I won't even go into the other 18, but
here's a follow-up for you.
So the myocytes need the insulin receptors activated. Heart and brain does not need insulin in order for the glucose to pass through. So I'm going to argue with you, JP, because that is to say that insulin doesn't unlock the ability of the myocyte to take on glucose, regardless of alternative pathways that can adapt. It's just misleading people. And we do need insulin in our body to function normally. But most Americans have insulin resistance issues. Upwards to 70 to 80% of people have insulin resistance issues. And so we only develop alternative pathways because we've broken our normal insulin.
Interesting. I did not know that. That's a good follow-up. And I just want to share Mandy's comment because I think a lot of people relate to her when it comes to the discussion around practitioners. She would rather go to her vet than her GP because her baby gets better care than her.
Yeah, but the problem is if you go to your vet with a sprained ankle and
obviously,
and all he treats is racehorses, you're in a lot of trouble.
You're gonna get some electrolytes and a slap on the hind end.
No. They shoot them.
Oh, do they really?
If you're a racehorse with a sprained ankle,
that's not good.
It's a bullet to the brain.
That is not good. Okay, Simpson has another question for us. Do ketones need insulin to pass through the cell membrane? Great question.
They do not. That's what's so beautiful about ketones. And ketones is a great fuel.
And they are the preferred fuel source for the brain. The brain
yeah,
glucose and ketones, but the brain prefers ketones, I've heard.
Yeah. And that may be part of why people get so much alertness and less brain fog when they're fat adapted.
Yeah. JP has your follow-up here. I think there was a misunderstanding. I was referring specifically to post-exercise, not in general.
Yeah, and like I said, that's an alternative pathway. That's not the normal physiologic pathway, JP. So I don't want to get in a fight with you. I just want people to not think that insulin isn't necessary to get glucose into your myocytes, because it's absolutely necessary.
Very interesting. Okay. Well, we are getting to the end of our time together today. And he says he agrees.
Okay, we're friends for life, JP.
Hang on.
Coffee.
Has a question. Does Dr. Phil have any comments on coffee? I'm feeling the community feels this is a necessary step.
I think it's probably the 50-50 split in the community. Now, Coach Raymond in Steak and Butter Gang, he's a big believer that you don't drink coffee before meals. He doesn't drink coffee at all. I will go with coffee free for a season once in a while, but I like my coffee because it's a social ritual my wife and I do. And it's important that we sit and have a cup of coffee in the morning. And when I don't drink coffee, I sit and have a mug of hot water, which actually is not a bad thing on a cold morning. But I do like my coffee, and but some people get stalled when they're drinking coffee, and it's amazing that when they quit coffee for a season, like 30 days, they'll unbreak their stall. And I think that's kind of a cortisol response. And I think it's an N equals one thing. If you're stalled, consider going 30 days without coffee, see how you do. But if it doesn't make any difference, then I wouldn't worry about it. Now, it's what you put in the coffee, of course. Um,
Are you putting in stevia and heavy cream?
well, we have kids at church. We have free coffee after church. And I see high school kids, they'll put 4 of those international flavored hazelnut
Oh gosh.
dairy things, 4 teaspoons, 4 bags of sugar, and then they'll put a little bit of coffee on top of that. And it's like, this is what keeps the pharmaceutical company going. So,
Obviously. Actually, I had a very interesting experiment with coffee. So my first pregnancy, I got about 6 to 8 weeks in, and then it just started making me feel nauseous, and just even the smell of it made me just want to hurl. So obviously I had to completely cut it out, and I've been a decaf drinker since learning that I just have I have zero tolerance for any caffeine, any sort of stimulants. It triggers all of my anxiety and just makes me feel like total garbage. I get really shaky and moody and disoriented, and I can't think straight. And so I use primarily, if I'm going to drink coffee, I use decaf. And then postpartum, I was just really craving it. I think it was maybe 3 months postpartum. And so we have a local roaster here who does a beautiful job of making all kinds of really nice roasted coffees, organic beans, all the good stuff. And so I decided to try it, and it was such a strange experience because when I reintroduced the decaf coffee, I made it like I normally would, and there was like all this hype and anticipation. I was like, oh my gosh, I'm so excited! The ritual coffee, I haven't had this in so long. But it was very strange how my body responded. I immediately got a down regulation of energy. It felt like somebody had just like put this weight on my head and on my body. I didn't feel as good. I felt tired, and I actually have a YouTube video on this that I shared my experience with. And then recently, like I said, getting pregnant again for the second time, I was already off coffee. As soon as I found out I was pregnant, I was like, well, I might as well just cut it out now because I'm not going to want it. And the smell doesn't bother me as much this time, which is nice. But I decided to have a cup of decaf one day with my husband, and same experience. And it's only been out of my system for about 6 weeks. It's still the same decaf, still the same quality beans, still the same roaster. But I had the same weird experience where I just felt completely out of sorts. I didn't feel right. My stomach was off all day. And I was like, wow, I must be hypersensitive. There's there's a book about these people called highly sensitive people. And I think I fall into that category in a few ways. I'm highly sensitive to EMFs. I'm highly sensitive to being in a vehicle that has too many electronics in it, at nighttime, like certain sounds, all this kind of stuff, lights, like fluorescent fake lights, just, I can't handle it. It's so crazy. And it's just interesting to me that my body would respond similarly to caffeine, even though there's no caffeine in it. It's a decaf, there's still trace amounts or whatever, but my body is just hyper reactive to it, you know?
yeah. Yeah, that's one thing I really like about carnivore is this whole
Mhm.
idea of N equals one. We need to pay attention to what works for us and what doesn't work for us.
Yeah.
and the courage to talk with other people. Um, but we do have this phenomenon where we listen to too many experts.
Yeah.
And there's a lot of influencers out there with different theories and different interests and different focuses.
Mm-hmm.
And I would say to make yourself not so crazy, people probably need to land on a couple of them, three at the most,
Mm-hmm.
and try to stay within those communities and not try to sample too many other communities because you can get real crazy if you are chasing what we call the holy grail of carnivore,
Mm-hmm.
which is, well, what's that one thing that someone else out there knows that I don't know?
Mm-hmm. Well, and
And
that's the whole carnivore harder and you'll get there, carnivore harder and you'll get there. It's like, no,
yeah,
not always the case. And actually, that leads to a great follow up question from Cobra 96100. I'll let you answer this one. I know the answer, but I'd like for you to.
does Phil do one-on-one coaching on SPG? No, I do not. It's been 19 months and I can't lose a pound. I never took any supplements and now I'm on a ton. I only eat beef, butter, eggs, and water. Um, one thing we do, I don't know if you're in SPG, Cobra, but 5 days a week we have open chat,
Mm-hmm.
which is the community helping people live on Zoom. And they're 2 hours. Um, Missy, who's on in the chat today, and Carnivore Cure, who's Todd, they're both on the open chat, and people just show up and they help one another. And a lot of times it's asking you questions and giving some ideas of something you might do a little different. Because carnivore does like variety.
Mm-hmm.
You do the same thing over and over and over again. You can get into a homeostatic health. And what that means is your body has just adapted to the same thing over and over again. And
Mm-hmm.
you need to re-stress it with a change to change your metabolism a little bit. So that's, um,
She's in the SPG.
yeah, she is an SPG.
Yeah,
So watching Rebecca. So yeah, Rebecca Heisman is such a source of knowledge.
she's
And
fantastic.
she's on later today,
Yeah. 5
uh,
p.m. Eastern.
4 hours from now. Yeah.
Yeah. Uh,
So
I would also follow up, Cobra. If you're in our community, you probably checked out the priming protocol and that sort of thing. And also, just note for yourself that it can take time. There are some members that say it took about 2 or 3 years for their weight to start shifting, and our weight isn't our only measure. And I'm sure you've had some NSVs with going carnivore. So when you kind of feel a little bit hopeless about the scale not moving, I would definitely encourage you to reflect back on those non-scale victories that you've had, whether it be better sleep at night, better digestion, improved mood, improved energy, improved cycles, whatever those things are, less joint pain. That can kind of encourage you and fuel you to keep moving forward. I would also say I love Phil's suggestion of plugging into the open chat. I think that would be a great place for you. I know you mentioned that you're shy, and that's okay. We welcome you. You don't have to come with your camera on. You can post questions in the chat. We're happy to answer as best as possible. There's also the 24-hour chat. There's also the feed. You can go through and check out other people's encouraging stories. But um, okay, good. Lindsay, nice to meet you. Well, we're looking forward to having you on the Rebecca call today. So if you feel so bold, you can ask a question on there. I will be hosting that call with Rebecca today, so it will be an awesome call. She's always so lovely. But I also don't want to take too much more of Dr. Phil's time or Phil's time. Charmaine has one follow-up question, and then we'll close out. Here it is.
does this apply to line diet? Does what apply to the line diet? Charmaine, give I'm lost the thread. So
I think, Charmaine, are you talking about, let's see, I don't see anything previous.
she's on, so she'll
Yeah, she'll
give me
respond.
some clarity.
Oh,
Homeostasis, yes,
yeah,
yes. So
question.
thank you so much. We talk about so many things. I lost my train of thought. Yes, when we do the same thing over and over and over again, our bodies tend to adapt to that. Now, I happen to know a little bit about you, that you're in a little different state right now because you recently had some surgery and you're recovering from that. But let me take a common example. People that only do OMAD or only do an OMAD is really a form of intermittent fasting because you're eating one meal a day, so you're fasting 23 hours a day. Even if you're getting adequate amounts of food, your body kind of gets in that rhythm. And sometimes the weight will start creeping up on people. And so maybe throw in a 48-hour fast, maybe do some two MADs or three MADs for a week, just to give your body a little different challenge. And you can stay lying during that time, but you're just changing the frequency of your meals. So your body's not getting too regimented.
Mm-hmm. Yeah, great response. She says, interesting. Well, Phil, I want to thank you for being my guest today. I really appreciate when you come on and share your wisdom and your story and your testimony. You're just such a wealth of knowledge, and you're so patient and generous with your time. I'm so grateful for all that you do. And for those who are wanting to connect with you, where can they find you? Where can they connect with you?
Well, since I'm not on social media, you have to do it through the Steak and Butter Gang. So um, I know Charmaine and Melissa and Missy, Todd, we all talk regularly. So anyway, you can join by going to SBG Meetup at Gmail. Let's see, meetup.com, right?
SBGmeetup.com.
sbmeetup.com.
Yep.
And you can join for free. But if you really want to get into the community and take advantage of open chat, you just join as a member. It's a paid membership. It's a monthly fee, but it's not very much.
No,
What is it? How much is it?
it's
19,
$30 US a month
30 a month? Okay. Yeah, it's not a lot. It's
for
less than a,
for the
it's like
value.
a,
Yeah.
it's like a Starbucks one day a week.
I think it's less than that. I think I remember my Starbucks drinks were always like $8 or $10.
Okay. Well, bye everyone. Thanks for having me on.
All right. Thanks for coming, everyone. Have a blessed rest of your day. And if you want to connect with Dr. Phil, you can meet us at sbgmeetup.com. Have a great day. Bye for now.
Bye.